Good morning. Now we'll be talking about examination of a urinary case. What are the various pointers which will give you an estimation of the diagnosis, and what are the various historical and physical examination point which will give you an idea of the diagnosis. It may not be possible to describe the entire investigative armamentarium simply because the investigations will vary from case to case, and some general investigations will of course be there, but then by and large the investigation might be case specific. So therefore we will look at historical points and we will look at the physical examination. Now the first thing that with the moment the patient comes to you, and the general history that we always take with reference to their age, for example, might give you a pointer to the kind of pathology they may be suffering from. For example, a case of a small child coming to you with a renal mass likely to have a nephroblastoma. On the other hand, somebody who comes in the third and fourth decade may have a renal cell carcinoma. I am giving you two examples. And somebody who's also present in roughly about the same time can also harbor a polycystic kidney disease. Now, this boy here, for example, is a boy of 14, 15 years, and he can also have an early onset polycystic kidney disease. Now, let's look at the complaints. And one of the commonest complaints that we usually talk about with reference to urinary tract is the pain. And in order to localize the pain, we would sort of go through some factors of anatomy and to localize the characteristics of the pain, localize the site of the pain. I think to keep in mind some parts of the anatomy is very important. Here's a young boy who is lying down with almost unclothed excepting for the lowest part. And there are various anatomical points that I have marked here. This is his xiphisternum. This is his umbilicus, which is marked as L4 and roughly L4. Not that it is always at L4. Sometimes it can even be up to L5. Roughly, it is in the region of L4 and L5. And if you take the distance between these 2 points and bisect it, say approximately at this point, I have put 2 points here. If you draw a line here, then that is a transpyloric plane. This line is a transpyloric plane. This is an important anatomical plane, and a lot of things happen here. But for the purpose of our discussion today, it is a hilum of the kidney we are looking at. That is approximately 4 centimeters away from the midline. This is the hilus of the kidney. So therefore, the point that I am wishing to make to you is the location of the kidney and is the palpation of the kidney, and the ability to palpate will obviously depend upon where it lies, and you can very well see that a large amount of it lies well above the costal margin, in other words under the rib cage. The place where it is located will depend slightly different from the right and left side because the mass of the liver is sitting here that pushes the right kidney slightly down. On the other hand, the left kidney is slightly higher up. So we have to take that into account when we are examining the kidney. Now, supposing if you roughly draw a shape of the kidney, and let us assume that this is L4, then somewhere around here, lower border of L3 would be somewhere around here. It's not precise, it's somewhere around here. And so therefore, if you draw a line, keeping this to be the hilum, just let us draw a rough kidney. Let's say this is the hilum. And if you draw it like this, somewhat like this, let's draw it. If you draw it like this, then you can see this is the lowest part of the costal margin. So you are likely to feel only the lower pole of the kidney. Majority of the kidney is going to lie above this particular line. So this has to be kept in mind. So now if we look at the back of the patient, so now this is the kidney that I have drawn from behind. There are surface markings here also. This is his T12, L1, 2, 3. Normally the kidney extends from L1 to L3, lower border of L3. And this is called what is called a Morris parallelogram. Now this is the hilus of the, I have slightly exaggerated the points in order to make it clear to you. This is his 12th rib, and this somewhere here would be the hilus of the kidney, should be the hilus of the kidney. That's about 3.5 to centimeters away from the midline, and this is about 8.5 centimeters, 5 centimeters being the width of the kidney. So if you draw roughly a kidney shape in this region, that is where the kidney is going to look. This is 12th, and just below this, see this hollow kind of space? This is the renal angle. This is the 12th rib. This is the renal angle, just below the 12th rib, and this is the margin of erector spinae. What you are seeing here, this is the erector spinae. So just in this area, this is the renal angle. So if you have pain which is arising from the kidney, or if you have fullness, if you have a swelling in the kidney, this angle is likely to be full. Right now it is, the boy hasn't have any pathology, so this angle is nice and hollow. But when it is enlarged, the kidney is enlarged, this angle is going to be full. I'm mentioning this along with the pain because I'm not going to come back to this area later on, and therefore I'm sharing those points also with you. So this is the renal angle, and this is the hollow, which is which will get filled up if there is a swelling of the kidney. And if you punch it in this area, the so-called Murphy's punch, then you will also elicit some tenderness, right? So please remember this area, this hollow here, and this is where the kidney swellings will show up. This is the Morris parallelogram. Roughly the location of the kidney is L1, 2, 3, lower border.